Hello everyone. I am Dr. Bholanath Pakhira is going to present a short video based on my thesis work Graphene and Nanocarbon from coal and their use as cargo for drug delivery including passage through blood-brain barrier. This work was done under the supervision of Prof. Sabyaschi Sarkar and Prof. Kumar Chattopadhyay at Shibpur, and I got my award on 5th on February 2019. The main focus has been the easy isolation of GO followed by its use as cargo to carry drug which can even cross blood-brain barrier for the drug delivery in brain. Now why it is important? How to combat brain diseases like Alzheimer, brain tumor, depression, schizophrenia to neuralgia. It is not possible to open the skull every day to administer medicine in brain. Drugs are there, but the problem is with BBB. Now this is the BBB we are talking about. And this is the blood and this is the brain. This clearly separates this blood and brain. And there is a tight junction there. So in this cartoon we are going to show the role of BBB. This foreign substances is high, we want to in, but it's just like a traffic sergeant says, I'm sorry, you are too highly charged, too large and not lipid soluble, so you cannot enter in the brain. So we have developed an alternate strategy to create a box-like hollow cage which can cross BBB, hiding any drug inside it, and we deliver in the brain just like a Trojan horses. And after delivery, it will be excreted out from the body, and we use a very cheap sources to design these boxes from low-grade coal. So what are the essential thing of these Trojan horses? It should be non-toxic, having maximum size of 64 nanometer. It should be amphiphilic in nature, that is water soluble as well as lipid soluble. It should be self-frozen, so that constantly monitors its location. It should work like a box which can be open and close, and it can be load and reload under proper stimuli. And last but not the least, it should be readily excreted out after its job done. So this is the system we're talking about, and we term this smart molecule which are got from low-grade coal. This is the open fist form, this A, and this is the closed fist form. And this is the open and closed fist form. Under proper stimuli, that's physical, chemical or thermal, pH or even aging, one form is converted to another form, and this closed fist form can be utilized using a large molecule TPP. Now you may wonder what is TPP. This TPP is tetraphenyl porphyrin, which is the photodynamic therapy drug, and it can be entrapped inside it. This is the stacking image showing the entraps of this molecule. You have optimized this stuff, and I'm getting WSCN, that is water soluble carbon nano onion. This is the onion like structure, and their size is 35 nanometer, and they are slightly negative charged. Using Kelvin injection in both mice having transgenic as well as normal mice, we injected a stuff and it processed through BBB. From the corneal view window, we have shown this is the image, and this upper portion is the control one. This is the treated one. You can see in control there is no fluorescence here, but in the treated one you can see there is a fluorescence. This image that the left side shows that WSCNO is reaching to tumor cell as well as to the normal neuron, and this right one saying after an hour this WCRO is going to present in brain, and after 3 days when the mice are sacrificed there is no trace of red. You can see here there is no trace of red. That means all WCNO is gone. So I will look at this movie here. This movie was taken from the corneal view window of this living mice. Consider on this part, you can see something is coming. This is the blood stream here. Now you can see there is lots of fluorescence. So thus, we are delighted to establish that WCNO crosses through BBB and enter in the brain near neuron without causing any perfusion. This raises immense possibility to drug delivery in the brain. This WCNO does not accumulate in the brain and excreted out from the body. So we utilize this open and closed form WCNO in trapping real drug like TMZ, which is a brain cancer drug, and a donepezil, which is an Alzheimer drug. So we have successfully developed a cargo that can be loaded with any desired drug or a composite drug, and that can be injected through blood vein, and its movement can be monitored, and near affected sites it can be deloaded under proper stimuli, and after its job done it will be excreted out from the system. This work has been published as carbon nano onion cross BBB, and extraction of preformed graphene oxide from coal is clean fist form in trapping large molecule, and this work was highlighted as Trojan horse to transport drug to brain in Nature India. I got this award also. writing a science story based on this. Thank you.